reduce wait times. We need to develop some streamlining just to improve efficiency from hospitalization to mental health services. Number two was working cooperatively with a continuum of care groups to get people on priority lists. Sorry, I'm getting back to my notes here. And then the third one was, boy, it was a point I brought up, trying to here in the chat. What was the third point, Victoria?
The third point, Ken, was having mental health services available exclusively.
Dedicated. Yeah. So what we talked about for number three was, and kind of relates to the number one action point, is that we weren't sure that in Pinellas County, with this population and the extraordinary challenges of persons experiencing homelessness to access care, transportation, navigating the system, that if we had a provider who was solely focused on mental health services for persons experiencing homelessness, and it really had dedicated resources to that population, that they didn't have to mix and compete with everyone else in the community, that really see them as a prioritized group because of the extraordinary challenges that they're experiencing. That if we could allocate dedicated funding to really increasing their access and providing dedicated services, we think that would help us with our priorities.
Thanks, Kent. I do want to mention we do have some providers like that in our community, but we also, are sensitive to one of our Housing First principles is that folks do not, we can't require them to receive assistance, but there's definitely a need out there. And so these points are well taken.
And Amy, that was for access to mental health services, just so you know. So up next will be Ganayel's group with mental health training for staff.
Hi, good morning, everyone. This is Joshua Jones with the CALL program. We're a new program affiliated with St. Pete Police Department. I'm one of the clinical supervisors. So we came up with our 3 action steps. The first of which is to provide training to frontline staff and police officers. We work in collaboration with the St. Pete PD's PATH team, it's Police Assisting the Homeless. One of the areas I've identified as a supervisor is for our staff to really be trained to work with the homeless population, particularly homeless mentally ill population. Many of the folks we encounter have identified mental illnesses, particularly schizophrenia. And so it's really important that our staff and any frontline staff in general know how to engage folks with schizophrenia and how to best support them and meet their needs, as well as law enforcement, because we work collaboratively with law enforcement. So that was our first action step. There was an adequate training provided by whether it's private clinicians or leaders in mental health in the community to really train frontline staff to work with this population. Number 2 is to offer support and consistent training and frequent training for staff to handle compassion fatigue. I worked in child welfare for a number of years back in New York, close to 15 years, and that was certainly an issue I experienced working with many, many dysfunctional individuals, families over the years, and certainly that could be an issue for folks in working with this population, particularly folks with mental illness who are homeless. And so it's so important that organizations offer training and instill in their culture training on compassion fatigue, so to prevent burnout and to prevent vicarious trauma. so that we can be sustainable in our professions and help our homeless families and homeless individuals and make sure their needs are met and help ourselves in the process by that same token. And number 3, establish a process with steps for the homeless population from start to finish and provide that information to the homeless population. So it's important that all providers know what steps to take to help the homeless from when they first encounter someone homeless, and how to get them what they need, whether it's mental health services, substance abuse services, housing, etc. And it's equally important that the homeless population know what they need to do to get help. How do we get information out there? How do we provide outreach so they know who they need to talk to, who they need to reach out to get the help? What steps do they need to take so they can take some ownership of getting help for themselves? So it's really important that information is disseminated to provider staff as well as the population itself. Thank you.
Thank you. Sorry, I missed your name. Could you share that with me again?
It's Joshua Jones.
Joshua. Thanks,
yeah.
Joshua.
You're welcome.
Okay.
Group 3 is commitment to community building, and that was Megan.
Megan, who do you have for me?
Lisette is going to be talking.
Okay.
Hi, I didn't realize what I was volunteering for. So we had a really good conversation about the community and how we can further involve them. So I can also add our points in the chat as well. As far as who should be at the table that we haven't already brought to, so the discussion was working more with faith-based organizations and churches, law enforcement, crisis response teams like the CAL team, behavioral health providers to help navigate how to access the system, trainings to better assist the school systems, and not necessarily for folks who meet the HUD definition or the HEAT guidelines, health providers like the ER, the mobile medical clinic unit, the clinics, private businesses involving corporations as they have the means to assist with other resources. For number 2, it was, utilizing the data and studies that we have. And the reality was that there's a disproportionate of Black and Brown communities who have barriers. So working on strategies that can impact those communities. And then the third one is needs for cross-pollination with other providers that may not necessarily be in homeless services. For example, like someone brought up St. Pete Works, collaborating with other networks that focus on job trainings and placements. Yeah, so those were our top 3.
Thanks, Lizette.
You're welcome.
Who's next, Avery? You're muted.
Thank you. It is working with jobs and careers, and that was Kitty's group.
I believe it was Gregory Lewis Fields, our reporter.
So I was nominated. Basically what we came up with was, one is employers, well, first, the community tradesmen was one of the issues that we think should have a better backing, or should I say a support. It is hard to get homeless, the homeless population to go back to school or to receive a trade without receiving some type of stipend for an extended period. Short-term training is good, but that was one of the issues that we saw. Employers receiving better support for OJT type programs or apprenticeship programs from the state and federal level. And the last one was, let me see, we went to those two. And I think basically just looking at the overall community, the quote unquote, the obligation that employers have to the community that surround them, for the simple fact that if the community is thriving, then therefore the employer or the businesses in that community should thrive also. So just a better livable wage output from employers to help increase the business in the community. At any given time, if anyone else on that team with me can add on, please do. I think that's pretty much what we came.
Thanks, Gregory.
Hey, Amy. Next, we have work to ban the box countywide. And that was Julie's group.
Okay, Julie and ban the box. Who do we got?
So that would be me, Deborah Fix Sanders. Good morning, everyone. So ban the box, and I was placed in that group, and so appropriately so. Our team, I just want to acknowledge those that were on our team because they actually provided some valuable input. We had Ms. Jackie Aziz from ACLU, Ms. Alexia Morrison from Reach St. Pete, Ms. Alejandra Arias, and please forgive me if I mispronounce it, from Senior Housing Case Management, as well as Mai Clarkson, and I hope I pronounced that right, which is a housing specialist for St. Petersburg Free Clinic. So when we initiated our conversation, it was an understanding that when it comes to banning the box, it's truly a result of a larger systemic issue that we have, specifically in understanding that the percentage of arrest largely impacts our young African-American boys getting needless charges against them. And so one of the initial thoughts was that in order to ban the box, that needed to be an intended, an intentional conversation with employers throughout the city and the county. So the three priorities that we came up with, the first one was to encourage the education, just what banning the box is, you know, what does that look like? And some of the results was to actually host a forum of local businesses so that they can learn the importance of banning the box and what that meant to our community members and our businesses, to pretty much find out what the economic benefits of that is and to get them to pledge that support. And so some of those partners that we identified would be the Chamber of Commerce, Downtown Partnership, PERC, SBC, Gulf Coast Legal Services, and Bay Area Legal Services. The city of St. Petersburg, of course, and other local and other municipalities, local fast food chains that also hire some of our returning citizens. Partner with the Florida Rights Restoration Coalition, as well as focusing on the work at home type jobs that really would not need to consider the ban in the box. So those are some of our partners. The second priority was to promote advocacy amongst that by developing a ban the box campaign. And I kind of almost volunteered for that. So look for that in those phone calls. We're going to be reaching out to you on that one. To identify different champions from all genres of the employment and working environment, so we can have their input as to how we can work together to really make this an initiative in regards to helping our returning citizens or just someone, and I love the way it was placed in our group, to help someone that at one small moment in time made a bad decision. Because we've all made bad decisions, we all just didn't get caught. And so we want to make sure that we are out there to have that information. And the third one was support incentives. Like we provide incentives for everything else. If we can have those employers that would commit to providing those services, what that would look like in regards to how we provide those incentives. For example, with the Summer Youth Intern Program that's financed by the City of St. Petersburg, private employers, they get an employee at half price, half wage. They don't pay the full prices for that. And so we thought that if we can provide those incentives and have that education, as well as promote via a campaign, we can help the county-wide in regards to a movement to ban the box. How did I do, team? I was voluntold that I was going to do that.
That's great, Councilmember Fix Sanders. I didn't catch all of your people to have at the table, but I know where to find you. So
yes, I will email that to you right now.
I will get that entire list from you. Who's our next group?
Our next group is include lived experience on the board. Margie's group.
Hi there. So we have a small but mighty group, and it was comprised of Earl Cook, who comes to us from Idaho. He's moving to Pinellas County, but he worked for the COC statewide in Idaho. So has an understanding of rural homeless issues. And Erica Hall, who came to us with a wealth of experience in New York and Washington. And Dr. Cantrell, who many of us are familiar with from some of our CLC meetings, who unfortunately arrived in pretty late, but was able to contribute, so that was great. Our reporter is Erica Hall. If you want to come on, Erica.
Hi, yes. Good morning, everyone. Thank you for having me. My name is Erica Hall. I'm just going to briefly go through the comments that our group came up with and let you take notes. We came up with a person needed on the board, or persons, is someone invested in community that is able to identify properties that can be used and or rehabilitated for supportive housing. For example, I had put a link in the chat around how the pandemic has forced buildings in Manhattan to maybe be repurposed for affordable housing. And this is also happening in other parts of the country. People are looking at ways to utilize commercial and industrial space, working in conjunction with their land use, local land use and zoning ordinances and codes to build supportive housing. One of the issues that one of our team members made was the pushback. We need to have someone with a connection to the community to deal with pushbacks in neighborhoods for people who do not want single, unrelated adults accompanying housing in their area. So I suggested, in my experience in Los Angeles and in big cities, for single homeless residents, you have more of a hotel type of environment where you have services related to their specific needs. If they're veterans, if they're whatever, as a single person, their needs are, you have that all contained in that housing, and you have more of an apartment type of living for single residents. And that would kind of take away the stigma for having single formerly homeless residents. in residential communities. So that was one thing that we talked about. We also talked about having someone that's a housing specialist to work with, to work outside of the one size fits all. We know homelessness is not a one size fits all. It's not monolithic. There's levels to it. So someone that understands that, Dr. Cantrell made an excellent point from her view about teachers and students and all of the obstacles when families are homeless. So, you know, you have that network and the connection to the school district, the PTA, and you have housing issues and people and case managers related to working with them on those issues. And those partners would be the Pinellas school system and the various groups that work with the teachers, the students, and everybody related to the schools. Same with domestic violence clients. You can't house everyone in the same place. LGBTQ plus, HIV plus, veterans, etc. We also talked about someone from the nonprofit sector that also works with for-profit developers to come up with housing theories of change that are sustainable, and also the Veterans Administration. So just making sure we take the time to understand that there's levels to homelessness. It's not one size fits all, and it's not one box and throw everyone in it. So it's having someone that understands. If they don't directly have the experience, they have the connections, or they have a rich network of people. As we say, it takes a village. You have someone in your village that you can contact that may have that connection. So that's how we approached it from that view. Thank you.
Thank you, Eric. I can hear the passion in your voice. So I know y'all had a great conversation. Who do we have next, Avery?
I'm sorry, team, if I missed anyone before you move on, I just wanted to get the comments from anyone else that I may have missed on our team.
Nope. Sounds like you got Thank you. Okay, up next we have existing relationships with organizations. This was Sam's group.
Hello, everyone. Our reporter is Trevor Mallory.
Good afternoon. Is it afternoon? Well, good morning, almost afternoon to everyone. Our group, we were able to complete it in time, but I'm pretty sure we could have discussed this a lot more. One of the main factors that I mentioned during our group discussion was the way that we can all figure out how do we want to work together as different organizations is through direct conversations. Personal one-on-one conversations, not just by reading another organization's mission or vision statement to see how or where they stand on this topic. You know, why is it working on existing relationships between organizations to bring racial equity to the homelessness system of care? You know, like I said, a lot of organizations have different views on racial equity. We also discussed that organizations have different strengths when it comes to working with the homelessness. So if we reach out to one another to actually have one-on-one dialogue or personal discussions, I think we get a better understanding of how organizations can come together to solve this problem. And also those who have experienced homelessness should also be representation that's at the table. They should definitely have a seat at the table for somebody that has already experienced that, because those are the ones that really know firsthand of what it's going to take to settle the homelessness, not only in our city or our county, but around the world. You just got to have that representation. And you have to being able to understand the different organizations' policies instead of making assumptions. And again, that's going to come from the communications that we all agreed on. You got to have those personal communications instead of assuming anything, because assumptions you may assume that my organization stands for something else, and you can be on the wrong page. So just having that one-on-one personal dialogue with each other explains a lot, and it will help more organizations come together and get a lot of these things done throughout the grassroots. And we also discussed that there are a lot of independent grassroots faith-based organizations that are providing services, and they're not a part of the meeting, as well as the funding being a barrier. The funding, we really didn't discuss how the funding should be dispersed, but it's definitely a barrier for some organizations. And if they had the funding, I believe they would have access to do a lot more when it comes to this situation. And some of our actions is that we think the COC's 3 to 5 year work plan already addresses a lot of this stuff through the stakeholder input, the trainings, and also the program goals. And we think that introducing the monthly COC provider council meetings so that some providers are aware that it even exists would be a big thing. And the last thing, one of the last things we discussed was providers should be allowed to request their participants/clients be a part of the discussion. So that goes back to just having the proper representation at these meetings. And I think a lot of organizations will find out that they have a lot more in common than they think they do. So it was very fun working with my group. We were a small group, but I think we came up with some real big topics of discussion.
Trevor, can you repeat the last one? I didn't get it completely. Providers should be allowed.
Yes, to request their participants or clients be a part of the discussion.
Thank you.
And that's my report for our group.
Okay, Avery, how many do we have left?
We have 1, 2, 3, 4, 5, 6, 7 more.
Yeah.
So
Yes, correct. Y ella lo que va a hacer es que she's gonna go.
So for the last few, if you could just highlight your 3 action steps. I want to make sure we capture at least the high level stuff, and we'll get with your facilitators for the rest of the information. So what's our next group, Avery?
our next group is coalition building, and it was Alex's group, and Esther will be reporting for that.
Okay, Esther.
Greetings, everyone. And so ensuring that I adhere to Amy's guidelines, our 3 action items are 1, addressing the identified issue of the VI SPDAT bias, reaching out to other organizations and businesses to contract and get them involved in the movement, and then to create a media campaign to highlight the value of addressing the issue and why it's important, including a day of service for the homeless community, a one-stop shop for needs, all hands on deck method.
Excellent. Okay, next group is advocacy, and that was your group, Amy.
Okay, I think we have Carla that's going to report for us.
Yep, here it is. So we really wanted, the top 3 was access to information, not just for those who are currently homeless, but for folks in the community as well, so that it's readily available for everybody. So there's a broader set. So if you become homeless, you're able to also already know and be making it normal. Connecting the advocacy group with the street outreach team and building that bridge there, as well as a campaign centered around normalizing the status of homelessness, and to create more of awareness around there's conditions that could create that that situation, and it's not an anomaly like some people want to believe. It only happens to those people. It can happen to any of us.
Thanks, Carla.
Theory of change is next, and this was Susie's group.
Hi, I can't remember who our person was, so they can speak up. But we talked more about the process because I don't think people were as familiar with theory of change. So we talked about how to set up like fair processes, just to give a little thing. Who was it that?
My name's Callie. It's C-A-L-L-Y.
Right.
And and our 3 steps were, the first one was who's at the table. So we thought it was very important to listen to the people who are most affected by these problems. They have expertise that might not be considered and have solutions as well. Our number 2 was to be culturally educated. So when going through the process, collaborative can make better and in more informed choices. As well as number 3 was to use trauma-informed care.
Next is reimagine accountability, and that was Marcus's group.
Good morning,
Oh,
good people.
Marcus, this had to be a big one.
Yes, it was, and I had an extremely talented group from frontline workers to executive directors and everything in between, research. So Dr. Stephanie Reed is actually going to be the one to kind of report out for us.
Good morning again, everyone. So our first action item was implementing a strong feedback loop from the community we are serving. And the emphasis here was on being accountable to the community that we're serving and providing homelessness services to. Action item 2 was to become active listeners and supporters of the population we serve. Serving as a liaison by listening to our participant stories and keying in on the underlying issues and serving as a greater link, a link to greater supports. And also in that paradigm, displaying active listening and making sure agencies are refreshing their internal trainings. And an overall thought on here was to identify one active listening practice that is consistent across all agencies so that everyone is using the same skill set and the same practices to listen to their constituents and to their participants. Action item 3 came from the idea of there being different contractual obligations from different sources of funding, whether it's from the county, from the state, from the federal government, and just creating a funnel or a holder for all funding that's going out to any homeless care agency. The recommendation was for HLA to be the funnel or the holder of all funding, and setting consistent metrics and contractual obligations for all providers that are providing services in the CFC.
Okay, who do we have next?
Language and frameworks, which is Brian's group.
All right, so Pamela is going to be going through our key points. I'm going to put them in chat too.
Okay, great, thanks. We had 3 action items. They had several subpoints under each one, but we'll just go with the main action item for today. The first one is that we need to develop communication materials that provide useful information to a variety of audiences. And then action 2 is to select our language and terms to be inclusive. Language should make sense to everyday people, and we should have an acronym guide. And action 3 is accountability around the language that's used. So our ability to, once we've chosen the language we're going to use, to make sure that people are trained to use it, that they know gracious ways to intervene when other people use it incorrectly, and to just kind of get a way of talking about those in our community who are living homeless that is pervasive throughout the community, both those who are in the system as far as, you know, service providers, that type of thing, and those of us who are on the call today, but also those who we want to get started helping us to solve this issue, like we've talked about before. So businesses and landlords, et cetera. That was ours. Thanks.
Okay, next up, we have replace or amend the VI SPDAT, which for those of you that don't know, that is the common assessment tool that the COC utilizes for entry into the coordinated entry system. And that was Dominique's group.
This is Jessica reporting for the group. So action item number 1, we're suggesting to replace the VI SPDAT with a new tool that is designed to include the needs of the local community. Action step number 2, we're asking HLA to dedicate time to research the national best practices and examples of other communities by reaching out to those communities and the other COCs who are experiencing the same issue. And then for number 3, we suggest creating a redesign committee that encourages and includes the participation of Pinellas County born and or raised Black, Brown, Indigenous people of color to develop an inclusive tool. And part of that should be incentives be built in to encourage ongoing participation. And that's it.
Thank you, Jessica. And our last group, Amy, is continuous quality improvement, and this was Carl's group.
Yes, I'm unmuting myself right now. Thank you very, very much for a great day. Want to thank members of this group that had a very, very good and strong conversation. Timothy, Anthony Jones, and Jessica, but to report out for us is Captain Picard from the U.S. Starship CQI. So Dr. Picard, you have the floor.
Thanks very much, Carl. I appreciate it. So we had a great conversation. The first point is vulnerability and access. There's an anecdotal sense that people of color often score higher for vulnerability on the VI SPDAT, and because of greater exposure to trauma. And that sometimes makes them harder to serve or perceived as harder to serve and less likely to get picked up quickly for rapid rehousing and other providers. Number 2 is that homeless service providers are often understaffed and underfunded. And there's a perception that data entry and collection takes away from their quote unquote real work with clients. So there needs to be some quality improvement around full staff buy-in to the importance of data and data disaggregated by race to improve the equity in the system. And number 3 is that data and quality is a human issue. So we need to do continuous quality improvement to build the understanding of good data and improve trust with clients so that clients know that we will use their data, keep it safe, and use it well to improve the system. Gathering data is potentially re-traumatizing, and it's always an inherent issue of providing care. So there can't be a separation between data gathering and care provision.
Okay, I think I at least have enough triggers that I'll know who to reach out to if I need to clarify statements. So thank you for that. Typed as fast as I could. I know the notes may not make sense on my screen, but I think I know what I need in order to help advance the work. I'm going to turn it over to the COC board chair at this time. I'm really thankful for Sean King's leadership. Sean is a government relations person at Habitat for Humanity, but he's been involved with the COC for a long time. And he has been especially dedicated to this topic and ensures that we spend time at every meeting focused on advancing our race equity agenda. So I'm going to turn it over to Sean, and he's going to talk about some further ways that you can get involved.
Excellent.
All right, you know, gotta unmute first. Well, first of all, I want to thank the HLA for putting this on, and all the staff members for being involved, the Foundation for Healthy St. Pete for helping fund this project and for being involved, for all of my fellow COC board members in attendance today. I know there's several of you that attended today. Thank you for being here. For the Diversity, Equity, and Inclusion Committee members, and for anybody else who's involved with the continuum of care, thank you for being here. And a special thank you to community members. Without the community being involved, we heard what the issue is. So now we know what the problem is. We have data on the problem. Now we get to tackle it. And one of the best ways you can get involved, and I know Amy is putting it in the chat, is to become a Pinellas Continuum of Care, Homeless Continuum of Care member. If you are homeless or formerly homeless, there is no fee to join. If you're an individual, I believe it's a $30 fee annually, and that just covers our administrative costs. And if you are an organization, it's a $100 fee to join the Continuum of Care. We also need help on all sorts of committees: advocacy, diversity, equity, inclusion, data system and performance, funders, strategic planning. If you've never done the point in time count, please, that's a great way to get involved with our local community continuum of care, get to know our local homeless population, and really see the struggles and the problems firsthand. So get involved with that. Obviously, policy is going to be huge. We heard a lot about that through the different work groups. Policy is going to take priority to do that, and service project. And then we just need help connecting. What service groups may be working with homeless individuals or may want to work with homeless individuals, neighborhood associations, corporations for financial support and strategic support, church groups. So I would encourage you to go to pinellashomeless.org, and hopefully I'm saying that right, but it's in the chat. It is on the very front page. You can find out how to become a member. We have a brochure, but I just want to, really encourage involvement. You took time out of your time today. We are not, as a COC board, and I know Amy as the Homeless Leadership Alliance CEO, this is the first step of one of many, or one of the very first steps of one of many. So we're going to hold ourselves accountable, and we need the community to hold us as a continuum of care accountable to really address these issues of diversity, equity, inclusion, and the inequity of people of color in our homeless continuum. So thank you for taking time out your day. Please, please, please get involved, and I will turn it back over to Amy.
Well, we just want to thank everybody for the time you've spent with us today. We will be sharing the recording after the session, as well as some resources or other things that came up in chat. I was just trying to chat with Carl and the whole group about, we definitely should reconvene this group, not only to hold us accountable and share how we're making a difference in the data and outcomes now that we have the brutal truth to face and know this information for our community. We have a whole committee committed to data, system, and performance. Sam Picard leads us in that realm. So I know he'll be taking this back to his group. But we also, Teresa mentioned in the chat, we need more voices at the table regularly. And we would love if some of you who attended today were a part of helping us redesign the system to be more equitable as we look at what assessment tool makes sense for our community and a number of the other challenges that came up today. We can only do this with everybody involved. So thank you, thank you, thank you for being a part of this. And please reach out to me if you want to get involved, or anybody on this call that you know. Most of them will be able to connect you, and we'll follow up as soon as the meeting's over with some additional resources Thanks again for being here, and we hope everybody has a great day.
Bye.
Thank you.